Welcome to Las Vegas Local Spotlight. I'm your host, Heidi Lusk, and today I'm here at Agape Health with the director and owner, Dr. Job Krugly. And his patients call him Dr. K, so can I call you Dr. K?
Of course, absolutely.
Thank you. Thank you so much for taking time to be with me today.
Absolutely.
So, Agape Health, I know that you have many facets to your practice. Can you tell us about everything that you offer here? I know it's a lot.
Yeah, so my specialty is sports medicine. My specialty is sports medicine, and we do all facets of sports medicine. So we do orthopedic stuff, we do neurological stuff, we do injuries, sporting injuries, we do concussions. We work with patients from all ages, all different types of athletic backgrounds, and we also treat patients who aren't athletes. Dr. Bradshaw's specialty is animal, and between the two of us, we're able to handle most issues.
Yes. So talk to me about some of your credentials.
Okay.
I know that you are a super specialist. You are one of the doctors that I think is rare in any industry, but especially the medical industry, where you're constantly learning and growing, and you have a different approach to everything. And so if you could kind of give us the laundry list of your certifications. I know you specialize in sports medicine.
So the laundry list, I started life as a personal trainer, so that's where my interest in physical health started. I felt a little bit limited with some of the people that I was working with, and I wanted to offer some more help. So I went to chiropractic school. Afterwards, I specialized in sports medicine. I'm board certified in sports medicine. I've also achieved a diplomate status with the American Board of Chiropractic Sports Physicians. Diplomate status is the highest level of education available for sports medicine. I've got other certifications as well, dealing with soft tissue treatments, dealing with concussion, dealing with head trauma, and other various things.
What do you do that's different with head trauma? For instance, I know you've talked about concussions. I know that you've been a key witness in many cases. Can you expound upon that a little bit?
Absolutely. So with any condition, I think the biggest missing piece most patients have when they come to see me is a diagnosis, is an accurate diagnosis. And so when it comes to head trauma, there are some very specific things that doctors must look at. Cranial nerves, vestibular system, your sense of balance, your sense of memory, recall, both short and long term. There's a list of things that need to be checked off in order to have a competent exam and come up with a good diagnosis. In a nutshell, those are some of the things that I'm looking at when a patient presents who's had previous head trauma.
And you mean previous head trauma, not just I was in an accident last week, but sometimes head trauma you found in your extensive diagnosis process that some patients have had head trauma at the age of a child that they didn't know about, and you've been able to kind of bring it back to that.
Yeah, so oftentimes oftentimes when I'm working with a patient who has a specific type of symptom or condition, we go through the diagnostic process and come up with a diagnosis for the patient. And while I'm working with a patient, sometimes in cases like that, there might be some pieces to the puzzle that weren't really answered and haven't been answered, and in my opinion, that's why the patient hasn't gotten better. So sometimes we can trace some of those things back to childhood or some other event. Obviously, there's some level of subjectivity to that. It's not as objective. It's because, I didn't see the patient at that age, but oftentimes when you know what to look for, you can see those connective pieces. You can actually say, hey, this looks like an X trauma, and then usually when I say that with a patient, the patient says, oh, you know what, I did have that. I fell backwards off of my bike, whatever. So
it's very interesting, and I know that you're able to kind of backtrack and help to correct some of those long-term deficiencies that patients have had. Now, I want to switch gears just briefly about your sports medicine side of it, because I do know that is what you are passionate about. Now, you have trained Olympians, you've trained boxers and gymnasts, bodybuilders, but you've also trained people like me and the older population. Tell us about what that side of your practice does, because you actually have a functioning gym here in your facility.
We do. And so when we're looking at health, there are many facets that need to be addressed. There is the mental component to any type of injury. There is oftentimes a nutritional component to an injury. Exercise often falls in most cases, meaning that most patients with a physical issue, a physical ailment, can benefit from exercise. They can benefit from exercise in the short term by using it to recover. They can benefit from exercise in a long term by potentially preventing issues from reoccurring. And, or I would also argue too that the healthier we can make a patient, the healthier we can help a patient be, the more of a buffer that they have before they get injured, the more of a buffer they have to prevent them from getting injured. So exercise takes a big role in most cases. We can take a patient who comes in with, say, a shoulder injury and help them become healthy enough to be able to use their shoulders for everyday normal activities. We can also take that same patient, if they choose, and design an exercise routine for them to get stronger, maybe develop more power, if they want to lose weight, if they want to tone up or do something of that nature. Really, that end result is going to be dictated by what the patient's goals are. But yes, to answer your question, we do a lot of exercise therapy, and that is, in my opinion, one of the biggest things missing in today's healthcare.
Yes, I would agree. Speaking of today's healthcare, how has this COVID-19 situation affected your practice?
You know, it's interesting. I'm still seeing patients like normal. We've decreased the total hours that we're open, just based off of need. I'm seeing more patients with acute traumas and acute injuries. The unfortunate thing, again, in my opinion, the unfortunate thing about today's environment is that when we need exercise the most and when we need good nutrition the most, now we're all isolated and gyms are closed, and it's hard to go and get that stimulus. It's hard to go get those things that help us recover. So how has practice changed? We're trying to create the best environment that we can to allow our patients to be as healthy as they can so that they can respond to any type of immune threats. As far as like running the practice is concerned, we've always been super diligent about keeping a sterile environment, so not much has changed there.
I can definitely attest to that.
Yeah.
You guys had hand washing stations within your treatment facility that I've never seen in other practices, to be quite frank. Instead of just a squirt of hand sanitizer, you were actually using soap and water long before the CDC said, hey, wash your hands, people. So, and the place has always been spotless every time I've been in here. And you know, I'm real picky about that kind of stuff.
Sure,
so.
and I would want you to be. I want all of my patients to be. I think that, you know, if you're going to go see a healthcare provider, one of the last things that you should worry about is if you're going to be exposed to something that you wouldn't otherwise be exposed to. So we do take as much precaution as we can. We have air filtration systems. We use natural products as best we can to disinfect all of the surfaces. And then, like you said too, yeah, there are hand washing stations in every one of our rooms.
That's fantastic. Well, I really appreciate you taking time out to be with me today. I'd love to have you back sometime.
Excellent.
And we'll take a look at the gym facility then.
Cool.
And hopefully by then we'll have some people actually exercising. Maybe you can show us a few key moves that they're doing to help in their recovery.
Absolutely.
So thank you again, Dr. Krugly. Again, this is Agape Health. They're located in Henderson. And what is your address?
Oh, terrible question for me.
That's okay. They're behind the Trader Joe's. That's on Eastern if you're headed up towards Anthem in Henderson. And it's Agape Health. And your phone number is?
Phone number is 702 410-5354.
410-5354. Again, that's Agape Health. You'll be able to find this video on my website, which is lasvegasrealestate.live. You can contact me if you want more information about Agape Health. I'm happy to send you a reference. I have been a patient. I've known Dr. K since he came to the Las Vegas Valley. So I'm very happy and feel very confident in recommending his services. And you can reach me at Heidi, that's Heidi, at lasvegasrealestate.live. I hope you're having a great day, and thank you again for tuning in.
Thank you.